Hey everyone, this is Dr. Glynn. I wanted to share with you my 6 tips for aiding weight loss. Okay, so the first tip is plate size. Okay, we are very visual people. All right, so when we look at a plate and let's say you look at a normal dinner plate, and when you're trying to lose weight, obviously the goal is to have less food, and you look at that plate and there's more sort of plate space than there is food on there. Visually, we're going to look at that and think that's not enough food, and it's going to encourage us to try and fill that up and put more food on the plate. So one of the tricks you can do to try and fool your brain a little bit is to have a smaller plate. So instead of having a full dinner plate, maybe have an appetizer plate. Put the same amount of food as you want on the dinner plate. It fills up more of the plate. It tricks your brain into thinking that it's an adequate portion of food. So that's one way around doing that. The second thing is eat slower. Okay. It takes about 20 minutes for our brain to get the signal for the stomach that we're full. So if you eat slower, you're much more likely to be able to notice that your stomach is filling up or feeling full quicker in a way, or better in a way, so you're less likely to overeat. So again, eat slower, try and chew mouthfuls of food a little bit more than maybe you do. Maybe put the fork down in between each bite of food, things like that, just to try and slow it down again, just to allow your brain and your stomach to get on the same page, so therefore there's not that sort of lag time. The third thing is be consistent, okay? Consistency is one of the most important things. We as people, we like consistency. Consistency breeds consistency. So when we're consistent in what we do, then we're much more likely to continue it. So again, consistency in how we eat. When we eat in times, your body or your stomach will get used to being fed when it gets used to. If you kind of feed yourself randomly throughout the day all the time, your stomach is kind of just going to get onto that habit of like being able to eat whenever it gets to eat. You can train your body to expect food when it gets to eat, and therefore it's going to react to that in a way that doesn't need you being starving hungry all the time, because it's never sure when it's going to get food. So consistency with that, consistency with exercise, consistency with just lifestyle, like consistency with when you go to bed, when you wake up in the morning if you can, all of that. Just the more consistency you can bring into yourself, the better overall you're going to be doing. The fourth thing is be realistic. Okay. If you are having like bariatric surgery, you're going to lose weight very quickly at the start, and then it's kind of going to slow, and it's going to be kind of like a rocky kind of down kind of motion. It's not just going to be a smooth line straight down. When you're not doing anything too drastic, you should really only be losing weight about a pound a week. Okay, anything around 3/4 of a pound, a pound and a quarter is kind of good weight loss. If you're going much more than that, you're likely to run into a few issues. So you want to be consistent, realistic with what you're trying to do, and recognize that when you're losing weight, it's not always going to be like smooth sailing, and you're going to have some bumps, and you're going to have some times where it's going better than others, and that's really important. Okay. The fifth thing is don't skip meals. It's very tempting. I speak to a lot of patients, and one of the things that they do is they skip meals. Okay, they maybe don't eat breakfast, don't eat lunch, whatever. They skip meals, and that's a real problem, because when you skip meals, it normally means that you're going to eat an extra time sometimes during the day to make up for it, or when you do get to eat next, you're going to overeat, which is going to be problematic, and you're probably going to eat more than you would have done if you'd have eaten those 2 meals, separately and when you're supposed to. So don't skip meals. I know it's really tempting to say like, well, I want to skip breakfast, I want to skip lunch, but don't do that. Try always to eat when you're supposed to eat. Okay, consistency is what we're looking for, consistency. And then the last thing is kind of like something that I run into a lot. People think that when they exercise, it means that they get to reward themselves with eating more. I don't know if you've noticed, if you've been running on the treadmill and you've looked at those like calorie counter things, and they're not always 100% accurate, but they give you an idea how long you have to run before you really lose, burn a certain amount of calories. 30 minutes can get you like 200 calories. An hour's worth of running on the treadmill can get you 300 to 400 calories. Now, it's easy to eat 300 to 400 calories. It's easy to eat 200 calories like that without even thinking about it. And oftentimes people do that. I know I've done it myself. So, I've exercised on a day and I've thought to myself, oh yeah, no, I've exercised, so I get to have that candy bar, I get to have that cookie. And oftentimes I eat more than I would have burnt anyway. So those are the 6 things to really pay attention to if you want to try and aid your weight loss and help your weight loss, okay? If you like the video, please subscribe with the subscribe button. Please check out our website, please check out our Facebook page, Dr. Glynn Bariatric Psychologist. Check out other videos, and hope to see you soon in the